Hello everyone, welcome back to the channel. Today's video is about yellow fever. What it is, how it spreads, its symptoms, how it can be prevented, and why it's considered a dangerous disease. This video is especially important if you live in or travel to parts of Africa or South America, where yellow fever is still present. Before we begin, here's a quick disclaimer. This video is for educational purposes only. It does not replace professional medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider if you have symptoms or health concerns. Let's start with a simple definition. Yellow fever is a viral disease caused by the yellow fever virus. It affects humans and is mainly found in tropical regions of Africa and South America. The disease gets its name from one of its serious symptoms, yellowing of the skin and eyes, known as jaundice. Yellow fever can range from a mild illness, similar to the flu, to a severe, life-threatening disease that can cause organ failure and death. Not everyone who gets infected becomes seriously ill, but when yellow fever becomes severe, it can be extremely dangerous. So, how does it spread? Yellow fever does not spread from person to person through touch, coughing, or sharing food. Instead, it spreads through mosquito bites. Here's how the transmission cycle works. A mosquito bites an infected person or animal, becoming infected with the virus. That mosquito then bites a healthy person, and the virus enters the new person's bloodstream. The main mosquitoes responsible are the Aedes and Hamagicus species. These mosquitoes usually bite during the daytime, especially in the early morning and late afternoon. This means people can get infected even while going about their normal daily activities. After a person is bitten, symptoms usually appear 3 to 6 days later. The early or mild symptoms include fever, headache, muscle pain, especially in the back, fatigue or weakness, nausea and vomiting, loss of appetite, and chills. At this stage, yellow fever can easily be mistaken for other illnesses like malaria, the flu, or typhoid fever. Some people recover fully after this phase and never develop a severe illness. However, for others, the disease becomes much more serious. After a short period of improvement, about 15 to 25% of patients enter what's called a toxic or severe phase. This is where yellow fever becomes extremely dangerous. Severe symptoms include a high fever returning suddenly, jaundice, that's the yellow eyes and skin, severe abdominal pain, continuous vomiting, and even vomiting blood. Other signs are bleeding from the nose, mouth, or eyes, dark or bloody stools, confusion or delirium, and kidney or liver failure, which can lead to reduced or no urine output. At this stage, the virus attacks vital organs, especially the liver, kidneys, and heart. Sadly, up to half of the people who reach this severe stage may die. So why is yellow fever considered such a serious disease? First, there is no specific cure. There's no antiviral medicine that kills the yellow fever virus. Doctors can only treat the symptoms and provide supportive care to help the body fight the infection. Second is the rapid progression. A patient can go from having mild symptoms to full-blown organ failure within just a few days. Third, the severe form has a high fatality rate, especially in places where medical care is limited. Fourth is the outbreak potential. If vaccination rates in a community drop, yellow fever can spread quickly and cause large-scale outbreaks. And finally, these outbreaks can overwhelm health systems, especially in low-resource settings, making it hard for hospitals to cope. The good news is that yellow fever is preventable. The most important defense is vaccination. The yellow fever vaccine is highly effective. Just one dose provides long-lasting or even lifelong protection. It's required for travel to certain countries and is safe for most people, except for some infants and individuals with compromised immune systems. Besides vaccination, mosquito control is also crucial. Reducing your exposure to mosquitoes helps prevent infection. You can do this by using mosquito nets, applying insect repellent, wearing long sleeves and trousers, removing standing water near your home where mosquitoes breed, and using window screens and insect sprays. When a large portion of a community is vaccinated, it reduces the overall spread of the disease, creating what's known as herd immunity, which protects everyone. To summarize, yellow fever is a serious but preventable disease. It's caused by a virus and spread by mosquito bites. The symptoms can range from mild to deadly. While there is no cure, there is a powerful vaccine, and prevention is the key to saving lives. If you live in or are planning to travel to at-risk areas, getting vaccinated and taking steps to protect yourself from mosquito bites are absolutely essential. Thank you for watching. If you found this video helpful, please like, share, and subscribe for more health education content. Stay safe, and I'll see you in the next video.